evening, everybody, and thank you very much for joining us for tonight's webinar on feline hypertension, which is being presented by Sarah Caney and very kindly sponsored by Feline Friends. Sarah is an internationally recognised specialist in feline medicine, and she has worked as a feline-only vet for more than 20 years. She trained as a specialist at the University of Bristol and is one of 12 recognised specialists in feline medicine working within the UK. Sarah has written or co-written 4 books published by her business, which is Vet Professionals, and this includes caring for an elderly cat. Sarah conducts online owner surveys and has published much of her research results in the Journal of Feline Medicine and Surgery. And as I said, Sarah is going to be discussing feline hypertension for you guys this evening. So over to you, Sarah.
Thank you very much, and thank you all for choosing to listen to this webinar. And I would also like to add my thanks to Feline Friends, a UK-based charity, for sponsoring this webinar. I think feline hypertension is a really worthy topic to discuss because it is an important cause of problems in cats, but importantly, we can actually diagnose and treat this problem. So there's lots of good things to say about it as well. I've put my email address on this slide, and I would be happy to receive emails from you, although I can't give you advice on your own cats. That's considered unethical for me to do so. However, if you would like, for example, a PDF copy of the slides I'm using in this presentation, then please feel free to request that via email to me. And if you just say it was the Feline Friends Hypertension webinar, I will know exactly which file to send you. So what I'm going to cover in this next about 40 minutes is the following list of questions. So what we know about this condition in cats, why it's a worrying condition for our cats to have, when routine screening for hypertension is a sensible idea, in my opinion. And then from a carer's perspective, so from your perspective, what you might spot as potential signs of hypertension in your cats and how this condition can be diagnosed and treated. And we'll finish with a case example. So firstly, what is systemic hypertension? Well, the full name, in fact, is systemic arterial hypertension. And this is when our patients have an increase in their blood pressure in what is called the systemic circulation. We have 2 circulations in the body, one that goes to the lungs, and that's where the blood is oxygenated, and one that goes to the rest of the body and provides that newly oxygenated blood to all the tissues. And that second one is the systemic circulation. Why does it matter in our cats? Well, as I've already told you, it's an important cause of problems in our cats. And some of these problems can be extremely serious, potentially even fatal. And one example on the right-hand side here, I hope not a distressing photo for you to see, but this is unfortunately the typical presentation of many cats with high blood pressure, which is where they present with a sudden onset of blindness. So apparently suddenly going blind because of the damaging consequences of hypertension to the eyes. And what you can see in Kitty's eyes is that firstly, the pupil, the black of the eye, is very, very large. It more or less fills the eye. There's very little iris around the edge of the pupils, but also within those pupils you can see there is red, that's bleeding in the eye, and poor Kitty has retinal detachment that has caused her blindness. How common is hypertension? So is it something that you need to worry about because it's likely in your cat? Well, unfortunately, yes. The answer to this would have to be that this is something that if you have a cat that reaches at the age of 9 or over, then this is one of the conditions to keep an eye out for. And a recent paper estimated that perhaps up to a quarter of cats aged over 9 years were affected by this condition. Certainly in my experience, the older the cat, the higher the likelihood of having high blood pressure. And it's often in cats as well as in people referred to as a silent killer. What this term is telling us is that, unfortunately, it's not an illness which makes itself obvious until it's really very serious. So many of our patients in which we diagnose high blood pressure might appear to be in many ways still quite well, quite healthy, as in the case examples you can see on this slide. So what do we know about the causes of high blood pressure in cats? Well, for the most part, estimated currently to be 80% of our cases, this condition is thought to be caused by other underlying illnesses. So what we would call a secondary disease, secondary hypertension. And the big example really that is important for us to know about is chronic kidney disease. All of you probably will have heard about kidney disease being an issue that cats unfortunately are quite vulnerable to, and more than a third of elderly cats develop kidney problems as they get older. And it's currently estimated that up to 60% of cats with kidney disease will develop high blood pressure as a consequence of their kidney disease. So certainly kidney disease is considered the most important currently known cause of high blood pressure in cats. And unfortunately, you can't predict which cats with kidney disease are going to develop high blood pressure. It's not necessarily linked to the severity of the kidney disease. So if your cat has mild kidney disease, it may still be at an equal risk of developing high blood pressure compared to a cat that has very severe kidney disease. Another condition that's quite common in older cats is hyperthyroidism, where our cats have an overactive thyroid gland that is overproducing the thyroid hormones. This is estimated to affect about 10% of elderly cats, and between 10 and 25% of cats with hyperthyroidism have high blood pressure. The link between these two conditions is a little bit less certain than the link that I've described between kidney disease and hypertension, in that both of these conditions are common in the same age group of cats. And in fact, we do know that we can't just treat the thyroid disease and the blood pressure problem will go away in those cats that have both high blood pressure and hyperthyroidism. So it may well be that actually the thyroid disease is not necessarily causing that high blood pressure, but that both hyperthyroidism and high blood pressure are similarly common in that same age group of cats. There are other less common conditions that also have an association with high blood pressure. So one example of these would be a condition often called Conn's disease, which is where an adrenal tumour overproduces a hormone called aldosterone. And there are other less common conditions that we know about. Up to 20% of cats with high blood pressure are classed as idiopathic. Idiopathic is the very posh medical word for we don't know what the cause is. And a great definition on the TV series House was that idiopathic means we're idiots because we don't understand the pathology, which I think is a very clever way of thinking about this. But essentially this means that the high blood pressure is there without any underlying disease, but of course still very much needs treatment. So why is having high blood pressure bad for our cats? Well, it's very damaging to the body, and in particular to certain what are called target organs, organs that are especially vulnerable to the damaging effects of having high blood pressure within your arteries. And those organs are the eyes, the brain and the spinal cord, the heart and the kidneys. When it comes to the eyes, of course, that damage can affect our cat's ability to see. And you saw a very dramatic example of that earlier on with Kitty and her very large pupils and her abnormal looking eyes. And she, of course, presented because she was blind. In milder cases, the cat may appear to be fine, and of course they're very good at adapting to any problems with their eyesight and learning where the furniture is, so may make it harder to spot they have any problems with their eyesight. But we as vets, and nurses also can do this, can look at the eyes and look at the back of the eyes in particular for clues of high blood pressure, such as bleeding and detachment of the retina. The brain and spinal cord is also very vulnerable to the damaging consequences of high blood pressure because, as you will know, the brain and spinal cord is encased in a protective bony shell that looks after it, but it means there's not much room for swelling. So if you have any bleeding, which is always an issue with high pressure situations, then that can actually result in clinical signs. And in mild cases, this can just be a cat that has some behavioural changes, perhaps is pacing, a little bit restless, or vocalising a lot at night. That showing signs of dementia, which are also common with other illnesses affecting older cats, so not just with high blood pressure. But in more severe cases, that bleeding in the brain or around the spinal cord could cause a more severe symptoms, and the cat could, for example, look like it has had a stroke. The heart, of course, is having to pump blood out into the circulation. And if the pressure in the circulation is high, then it's harder work for that heart to pump out into the circulation. And as a consequence of that, the heart changes. It has some changes to its structure to try and help it, if you like. And that means to us that we might hear some changes associated with that, what we call remodeling. So that the thickening of one of the heart chambers, in particular the left ventricle, can cause a heart murmur, and sometimes an abnormal heart rhythm. So that's the sort of thing that I wouldn't expect a carer to spot at home, but of course a vet in a clinic will listen to your cat's heart, and if a new heart murmur develops in an older cat, that can be an indication of high blood pressure, although again there are other conditions that also can cause a new heart murmur. And then lastly, kidneys, of course, I've said can cause high blood pressure. Kidney disease can cause high blood pressure, but high blood pressure is also damaging to the kidneys, and can lead to loss of the nephrons, which are the individual units that function within those kidneys, and mean that your cat's kidney function deteriorates. So as a carer, what signs might you notice in your cat as an indication of hypertension? Well, most often, unfortunately, you're not going to see anything because this is the silent killer. It doesn't make itself obvious. So everything may appear to be completely normal. In some situations, though, we will see evidence of high blood pressure. And that firstly might be because of hypertensive damage to certain organs, those target organs we've just talked about. So, for example, damage to the kidneys may worsen kidney function, and we may see that our cat is drinking more, which is a potential sign of kidney disease. Or, as in the example on the right-hand side, we might see behavioural changes in our cat that represent a new thing for our cat, perhaps excessive vocalization at night time, for example. And the most dramatic sign is often of visual problems like blindness that we've already mentioned. So certainly if as a carer you ever spot blindness in your cat, you see your cat apparently bumping into things or appearing to struggle to see, I would encourage you to make an appointment as a matter of urgency with your vets, because high blood pressure would be one of the important causes of this. And the sooner that is diagnosed and treated, the better the chance of being able to restore vision in your cat. And you can see poor Audrey on the right hand side here obviously had some vision to know the difference between light and dark, and when on the table in the consulting room she was trying to move towards the window, and you can see the windowsill in that picture, but because her eyesight unfortunately was so poor, if she'd not been stopped, she would have fallen off the table, because as you can see, she's putting her paw down thinking there's a surface when in fact there isn't. She too, like Kitty, has these very dilated pupils, so you can see the black of the eye. The pupil is absolutely huge in her, and this is often something that we see in association with blindness. So she has this slightly startled look to her. Sometimes, but not very often, we actually can see bleeding in the front of the eye, and that bottom photo shows an example there where you can see an amount of blood in the front chamber of the eye. And again, if you saw something like that in your cat, and particularly if there had been no bumps or anything that could have caused that to happen because of any sort of trauma, I would very much encourage you to take your cat to the vet for assessment. The other sort of signs you might see in your cat would be those linked to the underlying cause or other associated illnesses. So I mentioned a bit earlier on that chronic kidney disease was the most important cause of high blood pressure that we're currently aware of. And this is a very common condition. You probably all are very much aware of it if you've not, unfortunately, had a cat yourself that has developed this issue. And it certainly affects at least a third of elderly cats. And as I mentioned a little bit earlier on, it's currently thought that perhaps up to 60% of cats with kidney disease will develop high blood pressure. So a lot of cats, unfortunately, that are vulnerable to developing high blood pressure. If you're not familiar with chronic kidney disease, it might be helpful to know what signs that you might see in a cat with kidney disease. Increased thirst is certainly one of those. Weight loss, reduced appetite, sometimes signs of nausea or vomiting, also quite often seen. And many cats, particularly with advanced kidney disease, will just not seem themselves, so a bit lethargic, a bit depressed. It is important, though, also to emphasise that kidney disease can creep up very gradually, and so many cats actually with kidney disease can appear to be completely healthy. So this is another disease it's always good to be on the lookout for, and worthwhile considering the preventative healthcare assessments of older cats that help pick up this sort of problem, if at all possible. To make a diagnosis of chronic kidney disease, then we need to collect blood and urine samples from your cat and analyse these. And basically what we're looking for is from a blood perspective, is accumulation of things that are normally excreted by the kidneys. So a build-up of, in particular, protein breakdown products, things like urea and creatinine, more recently SDMA. And then from a urine perspective, what we're looking for is a reduction in the urine concentration. The urine becomes more watery than it should be. And both of these things in combination will give us our diagnosis of chronic kidney disease. Hyperthyroidism is the other illness that I mentioned a little bit earlier that is often found in association with high blood pressure. And again, I explained some of the controversies that there currently are in terms of whether hyperthyroidism causes high blood pressure or whether, I think more likely, they're just both common at the same sort of level in the same population of cats, in other words, the older cats. As you can see here, certainly it's worth knowing about, because about 10% of elderly cats develop hyperthyroidism, this overactive thyroid that's overproducing thyroid hormone, and up to a quarter of cats with hyperthyroidism develop high blood pressure. Signs of hyperthyroidism typically include weight loss. Both of the cats in the last slide you could see were looking pretty thin. And often that weight loss is in spite of the cat having often either a normal appetite or even an excessive appetite, a cat that's very, very hungry, seems to be eating masses and yet losing weight. That would be quite typical for certainly more severe cases of hyperthyroidism. Behavioural changes are also quite common, and those would include irritability, anxiety, restlessness, vocalising more, particularly at night, which I also mentioned can happen with blood pressure on its own. So this is another disease to consider if your cat is vocalising at night. Gastrointestinal signs like being sick, having diarrhea. Often a small increase in thirst is seen in cats with hyperthyroidism, and you can see both these cats as well have quite a poor coat. So a number of things to look out for that might indicate hyperthyroidism. As a vet, we will look for clues in our examination that might support that diagnosis. So one thing I'm doing in this picture is feeling for an enlarged thyroid, feeling for a goiter, and the thyroid is found in the neck in most cats. We sometimes have ectopic thyroids, which are elsewhere, but usually just below the voice box in the neck. And you shouldn't be able to feel it, but if you can feel it, that's what we call a goiter, and that's not absolutely diagnostic for hyperthyroidism, but it is a common finding in cats with this condition. We also often will find some clues in our routine blood profiles. For example, very common for cats with hyperthyroidism to have an increase in their liver values on blood testing, and most cases are quite straightforward to confirm the diagnosis by measuring levels of the T4 thyroid hormone. So hyperthyroidism and kidney disease are both, I think, other important diseases to mention in their own right, but in this instance mentioning with their relevance in the hypertensive cat. If you're at the vet clinic and your vet is considering high blood pressure a possibility, then examining the eyes is really helpful. And I'll show you a video of that shortly that just shows a little bit how I do this technique in the consulting room. And this is one way we can actually directly see blood vessels. And so we may be able to see abnormalities that tell us this cat definitely does have high blood pressure. We may, as a clinician, also be able to appreciate neurological problems in a cat that has perhaps damage to the brain or spinal cord due to their high blood pressure. I've already mentioned as well the heart murmur, so if we hear a new heart murmur, that can be a clue of high blood pressure. And on urine testing and blood testing, we may be able to appreciate damage to the kidneys. One manifestation of that is that often there is more protein in the urine sample, what we call proteinuria, as a clue of high blood pressure. So in fact, as a clinician, as a vet, there are a lot of situations where I would be thinking to myself, I need to assess this cat's blood pressure. Definitely in those cats that come in with problems seeing, particularly those cats that have sudden onset blindness. If I can see there is damage to the eyes that is compatible with high blood pressure, if I diagnose kidney disease, hyperthyroidism, or some of the other less common diseases where there's an association with high blood pressure, if I find that protein in the urine, if there's a new heart murmur or changes to the structure of the heart on ultrasound, for example, if the cat has behavioural or neurological signs, and especially if it's middle-aged or older cat, then it's definitely going to be on my list of things to do is to assess blood pressure. The charity International Cat Care, icatcare.org, have come up with some recent guidelines on what they think are sensible for us to do as part of our preventative health care in cats according to the age of cat. And I thought this might be a good opportunity to mention those guidelines. They're called their Cat Care for Life guidelines, and they have their own website, which I've put on the right-hand side of this slide, catcare4life.org, and you will see that according to the life stage of cat and the older life stages I've put here, so the mature, senior and super senior, for example, there are recommendations for what checkups should be done. And essentially in young cats up to 7 years of age, an annual health check is considered adequate. But once the cat reaches the mature age category, it's suggested where possible to do a more detailed assessment. And specifically when we look at blood pressure assessment, you can see that that is recommended once a year for cats in the 7 to 10-year-old category, and then ideally twice a year for the cats that are in the senior and super senior age category, but certainly as a very minimum once a year. And these guidelines I try and follow in my clinic, and I do think that they are well designed and appropriate based on my knowledge of cats and experience with cats as well. So if your practice are offering these opportunities for senior health checks, I would encourage you to take those opportunities and have your cat assessed in as much detail as possible. So how do we diagnose hypertension in our cats? Well, we are able to measure blood pressure in our patients, and I'll talk about the two main techniques that we use in our conscious cats in our outpatient clinics. But also examining the eyes is really, really helpful, as I've already mentioned, and actually the two in combination are what I do to try and get the most accurate and reliable diagnosis. So firstly, what methods do we have for assessment of blood pressure? Well, the first example I have on this slide is what's called the oscillometric technique. So this may be something that you've seen in the clinic that you go to, or that perhaps your vet uses in the clinic that you attend. Oscillometric blood pressure monitors have a cuff, and within that cuff there is a sensor that detects movement of the artery wall. And when you press a button, the machine will automatically inflate and deflate that cuff, which you place around a leg or around the tail of the cat in a certain way over the artery, so that it can do the appropriate calculations. And then it will automatically go through this process and give you some data as to what the cat's blood pressure readings are. These machines, there are a huge number of them available. Often, in my experience, struggle a little bit with cats, because cats tend to have quite fast heart rates compared to ourselves and dogs, and they are affected by movement as well. So your cat does need to be quite still when having this measurement taken. But they are quite popular, and certainly also for cats that don't like being handled, one advantage is you can put the monitor on, and then the cat can be sitting in its basket while readings are collected without anyone else having to touch the cat. The other technique which you may see used is what's called the Doppler technique, and this is where you have a probe which you place over the artery and you listen to the flow of blood within that artery, and then separately you have a cuff attached to a pressure gauge, and it's a manual technique, so you inflate the cuff manually whilst listening to what you can hear happening in that artery. So in some ways it probably sounds a bit less glamorous, perhaps even less scientific, but actually in my experience often gets you more reliable results, particularly in your conscious cats, for some of the reasons that I've already said. So currently for me, the Doppler technique is the one that I use in my clinic and find most helpful. One thing that we're very aware of, though, as clinicians, is this problem that's currently now being called situational hypertension. Situational hypertension previously had other names, which included the white coat effect or stress hypertension, and you may be more familiar with those terms. And what this means is that our cat doesn't have high blood pressure, but in certain situations, for example at the vet clinic, its blood pressure goes up, and therefore a high reading might be obtained. But that cat doesn't need treatment because it doesn't really have high blood pressure, it's just stressed. And of course, unfortunately, getting a high reading can make it difficult for us to know with this particular patient, well, are you stressed? Or are you actually genuinely hypertensive? So it's really important that we're all aware of this, and we do everything we can to make blood pressure assessment as calm and empathetic and cat friendly as we possibly can. So ways of doing that include having a nice calm location to measure the blood pressure, and I'm a very passionate advocate for the carer being present, so you being present with your cat to be able to reassure it when it's having its blood pressure checked. So I'm going to show a video now, which was kindly filmed by Decra, so hence their reference on the slide, and this is also on my website. This is my own cat, Sooty, who you can see is definitely less than impressed at being used as a model for a video. And I'm measuring his leg first of all so that I get the right size cuff, because if we use a cuff that is either too big or too small, it can give us false readings when it comes to blood pressure. And then I'm placing the cuff around his leg, and I'll prepare the area over his artery so that I can listen to his pulse. And once I get the probe on, you'll be able to hear the pulse sound a little bit like a steam train. So I'm inflating the cuff, and you'll now hear the pulse has disappeared. Now deflating the cuff. And you can hear the pulse just clearly starts to return at a pressure of about 140 millimeters of mercury. So that is the systolic blood pressure reading obtained on this occasion. And that video in full and with a voiceover is available on my website. If you look at vetprofessionals.com and then helpful info, scroll down to the video tutorials and you'll see this video and a number of others. What's a normal blood pressure for a cat? Well, at the moment, it's thought that blood pressures up to 140 are considered normal. And then we have various gradations of abnormality. So as you can see, blood pressure 140 to 159 is considered pre-hypertension. and then from 160 to 179, hypertensive, 180 and higher, severely hypertensive. So these are the guidelines. However, it's not always straightforward making a diagnosis of hypertension. And this is partly because of the situational hypertension issue that I mentioned, this stress-associated increase in blood pressure. We know from some studies that have been done that some cats, when stressed, their blood pressure will go down, but mostly it goes up, and in some cats it can go up by as much as 75 millimeters of mercury. And that might mean that we have a blood pressure result over 200 in a cat that is stressed. So we need to be careful not to overtreat, overdiagnose hypertension. And the second reason that diagnosis is not always straightforward is that actually both the machines that I've talked to you about, the oscillometric and the Doppler, are not perfect. And if anyone tells you that they are perfect, then unfortunately they're not telling the truth. We know that these machines give us a guide to what the blood pressure is, but they're not going to be as accurate as if we could invisibly put a needle into the cat's artery and measure what's called the direct blood pressure. And of course, we're not going to do that because that's not a cat-friendly thing to do in our poor cats. So the other thing that's really helpful when it comes to considering our diagnosis is to do an eye examination. Now, this is something you would do in the dark, but obviously that doesn't make a very engaging or useful video. But this shows my cat Sooty again having his eyes examined, and I'm using a light source and a lens. And this is a technique that I'm always very keen to show to vets as well. It's called indirect ophthalmoscopy, and it allows you to get a really good look at the back of the eye and see if there are any problems there. And there are a number of guides on my website in the free download section as well that explain not only how to do an eye examination, but also show some example photos of what to look for. And most cats have quite similar looking eyes when they're healthy, and they mostly look like that example on the left-hand side, where this is the back of the cat's eye. The white circle at about 1-2 o'clock is the optic disc, so this is the optic nerve head. And then the colour's not brilliant, but the red lines are arteries and veins at the back of the eye. But most of the fundus, as it's called, is this sort of yellowy, greeny colour. That's what a normal fundus looks like. The example on the right-hand side you can see is just very different. There's a lot of red, which is bleeding. There are some vessels that seem to really vary in their diameter. A lot is very fuzzy, out of focus, and this is because it's swollen, a little bit detached. So this is a very severe example, a dramatic example of hypertension. There are a lot of things that we can look for, and again, I have resources on my website you're welcome to access if that's of interest to you, and also to share with your vets if you wish. If we have a high blood pressure reading and we can see that there is evidence of what would be consistent with target organ damage due to hypertension, such as bleeding at the eye. This bottom photo here is another eye picture where you can see it looks a bit strange. That green area on the right is a large area of detachment, and there are smaller greeny areas of edema scattered over the back of that cat's eyes. You can also see the vessels look quite windy, quite tortuous, which is another potential clue of hypertension. So in that cat where the eye's looking like that and a high reading, that's considered enough evidence to say, yes, we've got the diagnosis of hypertension, we can treat the cat. But if your cat, let's say, is a 12-year-old cat that has been coming in for a routine healthcare assessment following those Cat Care for Life guidelines that I mentioned earlier on, everything is absolutely fine at home. There is no evidence of any illness from your perspective. The examination by your vet is also completely normal, including examination of the eyes, and the only thing that is found is a high blood pressure reading. Then of course stress, that situational hypertension, is very definitely a possibility, which means that before starting any treatment, we need to repeat the blood pressure assessment to confirm it is a persistent abnormality. Make sure again that we do it in as calm and quiet a way. Let the cat have plenty of time to get used to us and the equipment before we collect readings. For cats that are very stressed, actually having a pre-vet visit, gabapentin, which is a painkiller you may have heard of from, it's used commonly in human medicine, but in cats can be a little bit sedating. That can help prior to blood pressure assessment for some cats that get stressed by the vet visit. All these things are important to make sure that we make the correct diagnosis and we don't just start treatment for the wrong reasons. If treatment is needed, so if we confirm the diagnosis of systemic hypertension, then if you're UK based, there are 2 veterinary authorised treatments that are available. So these are treatments that have been specifically assessed for their effectiveness and their safety in cats, and are made in a nice sort of cat appropriate size pills or cat appropriate concentration of liquids, and those are amlodipine in the form of Amodip, which is the tablet medication you can see, and Simintra, which is a liquid medication. Both of these are veterinary authorised, both of them are effective, and indeed some cats need a combination of the 2. They work in a slightly different way to each other, but so some cats need a combination of both medications to adequately control their blood pressure. And if your cat is found to genuinely have high blood pressure, then it's quite likely that your vet may recommend additional tests to look for underlying causes of that high blood pressure, such as chronic kidney disease. So just to finish off with, we'll look at Audrey in a little bit more detail. You saw some pictures of Audrey earlier on with her trying to walk to the window and almost walking off the table. And I would like to emphasise we didn't let any harm come to Audrey. She was quite hesitant because her eyesight was poor. I asked her owner if she would mind me taking a photo, and she kindly said no. And of course we did. We made sure that as soon as the photo was done, we shepherded her back onto the table again. But you can see she's got very severe visual deficits. She is thinking she can walk towards the light. She's obviously aware of light, but unfortunately not aware that there's a gap between her and the windowsill. And she had these very, very large pupils that you can see. So she looks very scared actually, because fear often will dilate the pupils, but her pupils are even larger than you would expect with that, which is certainly very unusual to see in a cat and should be another sight that raises alarm bells. And then shining a light into her eyes, so that the right hand picture you can see they look quite strange, and that's because in her we can see the retina. So if you perhaps peer a bit more closely at your computer screen, you can see in the eye closest to you, which is Audrey's left eye, actually there are some little red lines, and those are blood vessels on her retina. But because her retina has detached and is closer to us, it's closer to the front of the eye, we can actually see it, which we never should be able to when we shine a light into the cat's eye. So she has a bilateral detached retinas, which have caused her blindness, and her blood pressure was very high. So because we've got these 2 things in combination, we can be very confident that we've got the correct diagnosis and move straight on to treatment in her. And she was treated with amlodipine, and actually we were able to get some improvements in her eyesight. It can be a little bit 50-50. I certainly would say that many cats do remain blind, sadly, unfortunately, even when their high blood pressure is treated. But as you can see in Audrey, her pupils are much smaller now that her blood pressure is under control, and her vision did improve a little bit. She's still quite significantly impaired as a result of that hypertensive damage, but some improvements, and we were able to maintain her vision. And we needed to tweak the dose of her medication a little bit. She actually responded a bit more than I had wished to the dose I started her on, so we backed off her dose a little bit, but she did very well with treatment of her high blood pressure. So in conclusion, I think this is a worthy topic to discuss because it is quite common, unfortunately, in our older cats, and as you can see, it can be very serious. Ideally, through our health screening of cats as they get older, we hopefully will diagnose and treat the hypertension before it's caused significant harm to our cats. So ideally we diagnose and treat it before our cats have any visual impairment. But even in those cats like Audrey, where they are either severely visually impaired or even completely blind, treating the hypertension still makes the cat feel an awful lot better. And one of my patients from many years ago would still, even completely blind, be able to catch mice. He lived in a lovely rural location. There was no worry about him being hit by cars outside, and he used to go in the garden and catch mice. I don't know quite how he managed it, but completely blind he did it, and he was very much happier with his blood pressure under control. I always feel that cats with high blood pressure sort of look like they've got a headache as well. I think it probably is more uncomfortable than perhaps they necessarily let on to us. Although diagnosis does have its challenges, it certainly is possible to assess blood pressure by measuring it and examining the eyes. And this is something that we can also treat. As you can see, there are some good drugs available which are very effective and often extremely easy to give and very well tolerated as well. So there are good things to say about hypertension. This is a screenshot of my website for further reference, and the helpful info section is one that I've mentioned a few times in this presentation. So you can see free downloads, that's for the technical guides, video tutorials, obviously for the videos, some pictures of some of my book covers there as well. And then if you are interested in learning more about the science of hypertension, there are some consensus statements from various veterinary societies, and I think both of these, certainly the top one, is free to download. You don't need to be a member of the journal or pay a subscription or anything like that. But if you Google ISFM consensus guidelines hypertension, you'll be able to get a link to that and you can have a read. You might find that interesting. The ACVIM consensus statement at the bottom, I think similarly is free to access. That's written by an American panel of clinicians, and very recently published, just either earlier this year or last year. And I will stop by thanking Feline Friends again very much for their sponsorship of this webinar, and I would be happy to answer any questions that you have. Thank you very, very much.
Thank you very much, Sarah, for that really interesting talk, and I hope everyone who's listening this evening has found that really interesting. So we've got a couple of questions that are starting to come through. So if there's anyone else who hasn't asked a question and wants to, if you go to the bottom of the screen and there's a question and answer box. So if you just type your question into there, and that'll come through to me, and then I can put that through to Sarah. So I have one question that's come through, and she's asking whether or not you would recommend owners to learn how to do blood pressure readings on their cats at home themselves, whether or not it's worth owners actually buying a machine themselves and doing that.
That is a brilliant question, and I would say in principle I think it's a great idea, because of course your cat at home should not be stressed, although it's fair to say that whenever we sort of meddle with things at home, you know, our cats are quite clever and they will pick up on things. So I don't think we can exclude the possibility of situational hypertension in our home under those circumstances. There are apparently some very, very inexpensive blood pressure monitors that are available through the likes of Amazon. These are oscillometric monitors, so they're like the first monitor that I talked about. And the main problem, I guess, with these is that there is no data, there is no sort of validation that we're aware of. So anyone can sort of sell a machine. They don't necessarily have to prove how well it works. So there is a risk if you buy one of these cheaper machines that it could be just giving you numbers that don't necessarily mean anything. I do know, having said that though, that some owners certainly have bought some of these machines and do feel that they are helpful, and I don't even know off the top of my head what models they are, so I'm not going to recommend any, because there's no published data, as I say, so it would be wrong of me to recommend them. But it's maybe something for you to consider. The Doppler machines tend to cost, I would say, about £800, so they're quite a lot of money to invest in as an owner, but very worthwhile obviously for your vet clinic. And if you were feeling particularly wealthy, there's nothing to stop you learning that technique. It's not, if you've seen it, it's not, well, you have seen it in the video, it's not particularly complicated. It takes a little bit of time to get used to and to do, but I would say, you know, you could train yourself to do it or be trained to do it if you so chose.
Thank you very much. So I've had another one, the lady asking, do you shave the fur to measure blood pressure?
You don't need to shave the fur for either of the techniques. If the only, not really an exception, the only thing I would say is that for very long-haired cats, it can take a little bit longer if you're doing the Doppler technique for the ultrasound gel, which is what we use on our probe to really work its way into the coat. So if you do shave the fur, it's a bit easier. However, it's potentially stressing the cat. So I don't routinely do it, but it may be something that is, you know, some vets prefer to do. And if they do, you just should leave the cat plenty of time to really recover from that potential stress before collecting readings.
Thank you. And then I've had one saying, do you know if there are any breeds more or less prone to this condition?
That is a great question. I don't think at the moment anything has been published with breed predispositions, but it may well be a factor. Certainly what we do know is that age is very much a factor, and that as your cat ages, it every year has an increased risk of hypertension from developing. So that is definitely known. But breed associations, I think we're less knowledgeable about at the moment.
Okay, thank you very much. So I've got a few more coming through. So where hypertension is found and successfully treated with amlodipine, but CKD is also present, would you generally explore medicating the CKD as well, especially in a very senior cat?
I would definitely, where possible, advocate as you know, as thorough an approach to each individual cat. So yes, definitely there are treatments for kidney disease that would be recommended. Most helpful treatment is actually feeding a phosphate restricted food, a specially designed sort of kidney diet. But there are other things, including some medical treatments, and one of potential difference between the two blood pressure drugs would be that Symmintra has a veterinary license for blood pressure. That's the liquid medication, but it also, in a slightly different strength, has a veterinary license for treatment of cats with kidney disease. So a cat with kidney disease and high blood pressure, that might push you to use that medication as your first choice. But there are other factors that need to be taken into consideration as well.
Thank you. And then we have, if hypertension is due to thyroid, hyperthyroidism, and the thyroid is treated with radioactive treatment, is it likely that the hypertension might naturally reduce?
So that's, again, a really excellent question. And the answer to that is that in 99% of cases, whatever treatment you give for the thyroid, whether it's radioiodine or surgery or medication, the cat needs its blood pressure management, even if the thyroid is removed or even if it's treated with radioiodine. And over the many years I've worked, I've only had one cat where treatment with radioiodine and the cat's hypertension seemed to resolve. And that was a cat that had ocular damage as a result of high blood pressure. So it was very much a confirmed case. But when I talked with all of my esteemed colleagues around the world about this case, they said they'd never seen a cat do that. So, and it certainly is very, very rare for that to happen. So in general, the cats, that if they've had thyroid disease, even if it's treated, if their blood pressure is high, they need specific treatment for the blood pressure for the rest of their life. That is the normal picture. Okay.
So one last one that's coming through. They're asking about the concurrent use of amlodipine and Symmintra together. At what point, when would you have to use both of them together?
So generally I would say either refractory hypertension, which means hypertension that's not really responding to a single medication, or it may be a cat where, for example, the cat had kidney disease and didn't have high blood pressure, but was receiving Symmintra for its kidney disease and then went on to develop high blood pressure. That sometimes is a scenario where amlodipine is added. There are lots of factors, and I don't want to cause any confusion by going into too much detail, but amlodipine tends to still be used in cats also with very severe hypertension. So if the blood pressure is certainly over 200, amlodipine is generally part of the picture, considered a necessary part of the picture. The Symmintra on its own tends to be used in the cats with the less severe hypertension, but the two of them can be used very, very effectively in combination. So it's a bit of an individual thing, and I hope that answer wasn't too confusing.
Okay, thank you very much, Sarah. That was wonderful. So we've had a couple of comments coming in. Actually, one more sneaky little question's just come through. Could you explain a bit more about vocalization, please, and are there certain things to be concerned about?
Yeah, I'll just, vocalizing it at night is often something that owners of older cats report in their cats. It is very common. So the first thing is to say, don't panic if this is what your cat is currently doing. There are quite a few potential causes, but the top ones that I would always consider would include high blood pressure. And a good reason for including it is that, obviously, as you've seen, it's treatable. So it's always good if you can find a cause that you can treat. Another important cause of vocalizing a lot, particularly at night time, would be hyperthyroidism. And again, that can be diagnosed and treated, so is a good one to have on your hit list. But probably the next one that is really important as a cause of increased vocalization would be cognitive dysfunction syndrome, what's called CDS. And this is the cat equivalent of Alzheimer's disease, so dementia in your elderly cat, caused by, well, a number of changes in the brain. That is, unfortunately, as is the case with people, not something that we can treat in the sense of reversing, but we can support the cats. There's still lots of things that can be done to support the cats that is affected by that. And if this is something that's particularly of interest, I would recommend the Elderly Cat book, which is the one on the left of the three there. My co-author for that was Vicky Halls, and probably a lot of you will know Vicky Halls. She's a very well-known and respected feline behaviour expert, and this is one of the topics that's covered in quite a lot of detail in the book, including for those cats with cognitive dysfunction, tactics for surviving it as a carer, because it can be something that's actually really difficult to live with if every night you're woken multiple times in the night by your cat sort of yowling at the side of your bed and sounding like it's in terrible pain or distress. If any of you are suffering with this, firstly, have huge amount of sympathy, but also don't suffer in silence, because to be a good carer of your cat, you do need to look after yourself as well. But that book might be a useful resource, but also, of course, speak to your own vets and vet nurses for advice.
Absolutely. Well, thank you very much, Sarah. That's been absolutely wonderful. And again, I hope everyone's been able to take something away from that and hopefully have learned something. I've had lots of comments come through that to say, actually, thank you so much for a wonderful presentation, that it's been full of lots of really useful information. So once again, I'd just like to thank Feline Friends for sponsoring tonight's webinar. And I'd like to thank Phil, who's in the background, for the webinar vet. And again, I'd like to thank Sarah for such a wonderful presentation this evening.
My pleasure. Thank you for looking after me.
Oh, you're very welcome. And I hope you all have a lovely rest of the evening. Good night.